Hello, everybody. Welcome to the Christina Crow podcast, where we connect the dots in search for more balanced mental health. Today, we are making invisible things visible for the good people of Ontario, including their therapists, talking about the landscape of accessing quality mental health care. In today's episode, I'm talking to the president of the Ontario Association of Mental Health Professionals, Jane Alway. Jane is a registered psychotherapist who's also a certified member and the president of the association. Jane serves on the Advisory Council of Eating Disorders of York Region and has developed and facilitated programs for those with eating disorders. She's also done community presentations to raise public awareness about the risk factors and serious health effects of eating disorders. She's passionate about learning and has worked as a teaching assistant for graduate students within the Faculty of Behavioral Sciences at Yorkville University, serves as a peer facilitator with the College of Registered Psychotherapists of Ontario. Jane is a trained facilitator and public speaker who has had many years of professional and volunteer experience working with people who have special needs and has several years of experience working within medical clinics. And she has her own private practice in Richmond Hill, where she provides psychotherapy to individuals, couples, and families. Jane, thank you so much for making time out of your schedule to be here with us today.
Thank you for having me. This is exciting.
It's great to have the president of the association that I belong to, that I'm really proud to belong to, and have served on the board in the past and had a wonderful experience being a member of the board and learning about the inner workings of the administration, really, of mental health in Ontario in a lot of ways.
For sure. It's a multifaceted endeavor. And yeah, for sure.
Yeah. One of the things I think I will ask you to start us off with is can you just explain to our listeners what exactly the association does, who it represents, why we have it, all that stuff.
So OAMHP stands for Ontario Association of Mental Health Professionals. What makes us unique is we represent, you could say, the full spectrum of mental health service providers. So within our midst, we have consultants, we have counselors, psychometrists, psychassociates, psychologists, registered psychotherapists. We may have people who work within the school board, either as guidance counselors or people doing school-based assessments. We have some social workers in our midst, so the full spectrum of mental health care providers.
Okay. And is it a large group?
Yes, so we're now, I believe, over 3,000 strong in Ontario. We do have some members outside the province, but the majority obviously in Ontario. Yeah.
So, okay, this is a question I've actually always wanted to ask. Sometimes when we talk about like wait lists in Ontario for mental health, is it because there's not enough mental health clinicians? Like between the psychologists, the social workers, the psychotherapists, are there not enough of us to service our population? How do we know?
So I think right now we have a number of challenges. One can be trying to connect somebody with the appropriate provider at the appropriate time.
Mm-hmm.
If that doesn't happen, that can create a glitch or a wait list issue. And so speaking to OAMHP, that's one of the reasons we value all of our members. So for example, if somebody is in need of medication, that person obviously needs to be seen by a psychiatrist or a medical doctor or a nurse practitioner. But then beyond that, what are the other services that that person needs? If they're needing of, say, a formal diagnosis, obviously they're going to be seeing a psychologist or a psychological associate. But then for talk therapy components, for talk therapy components, they could be seeing a social worker, a registered psychotherapist, yes, a psychologist or a psych associate. Or they may benefit from seeing an addictions counselor, so a non-regulated professional. should say we have both regulated practitioners as well as unregulated practitioners, and both serve a really important role in the landscape. So I think
Mm,
one of the things that creates wait lists is an overwhelming spectrum where the moving parts are not well understood, sometimes by the practitioners themselves,
yeah,
and then not understood for obvious reasons by the members of the public who are seeking the service.
right,
And then layered on top of that, there's the insurance issue. So for people who
right,
have insurance, they may not be covered for the practitioner who could best serve their needs.
right.
That creates a further barrier.
Mhm.
Um, yeah, so those are a few of the things that can create bottlenecks.
Yeah,
Yeah, just a
a
few.
lot. Yeah, it's a lot. And then, so if I'm just a regular member of the public,
Yeah,
I've decided it's time to, talk to somebody.
yeah.
Decided I've just been stuck or struggling for too long, or my kid has, or myself and my partner have. Then where do I begin? Do I Google find a therapist near me, or how do I know which type of practitioner I need?
Mhm. So yes, for example, OAMHP.ca, one of the services we offer is you
Mhm.
can go onto the site and find a therapist, and
Okay.
you can look for in terms of what you need, you can look for a therapist in terms of where they're geographically located.
Yep.
Tends not to matter quite as much in the virtual world.
Okay.
And also, what are you seeking services for? Is it for a low mood, anxiety?
Right.
So you can look for that. The other thing I touched on insurance. So do you have private insurance or workplace insurance?
Mhm.
If you do, checking to see who you're covered to see.
Mhm.
Are you covered for a social
Type of
worker?
practitioner.
Yes. So are you covered for a social worker, a registered psychotherapist, psychologist, all of the above? And for how many sessions and or for what dollar amount per year?
Right.
Um, so the way I practice, I always want people to come in with their eyes open, understanding what kind of benefits they have.
Yep.
Um, if they don't have benefits, and so many members of the public are working in environments where there is no private coverage,
Mhm. Or it's
or
just so it's like $500 or $400. Like,
yes,
gee,
yeah,
that
yeah,
doesn't get you very far.
yeah. So I mean, and I hate to ask members of the public to, especially if they're trying to get help, to be advocating for themselves. But
Oh,
one
that's you in
aspect,
Ontario. Like,
yeah, yeah, but
rattle
yeah,
the cages.
yeah, I mean, one aspect is okay, advocating for healthcare or workplace benefits or increasing those. So if it's $500, that will not give a lot of sessions to somebody who's seeking help, and increasing the number of practitioners within the coverage. So
Right.
yeah, I can give you a quick example. So for
Sure. That'd be great.
example, I mentioned I work with people who have eating disorders, and I've had instances in which, say, person's referred to me,
Mhm.
and I check with them, do you have coverage? They may have coverage, but they find out they don't have coverage, say for a registered psychotherapist. And that creates frustration and bottlenecking again, because,
Yeah.
okay, so a referral's been sent to me, then I have to have a discussion with that person to redirect the referral to a colleague for whom they may have coverage.
Mhm.
It can create a bottleneck if that particular type of practitioner has already got a full practice. So
Right.
yeah, yeah.
Yeah. And so for everyone that's listening, you can find a therapist, quote unquote, that you can use your insurance for, you can
Mhm.
pay out of pocket for.
Yeah,
Most of these receipts are tax deductible medical expenses at tax time. And sometimes that is nice, and sometimes it's really relevant to you, right? Depending on your situation.
yeah.
Or you can try and access psychotherapy through a public program,
Mhm.
or through, I don't know, like hospital
Yeah,
program, an outpatient program,
yeah.
or a public agency. So what does that look like in terms of how long does that take?
Yeah, so the wait lists for either could say a hospital or clinic-based program, they tend to be quite long. Again, because I think we need to expand through our workplaces
Yeah.
more mental health coverage through insurance.
Right.
So as a result, because there are so many people who don't have that, there's a lot of reliance upon the public system.
Mhm.
So in that case, oftentimes it may be a referral through a doctor or a practitioner within a clinic
Mhm.
to either a hospital or clinic-based program,
Mhm.
and then the person is connected with that program.
Mhm.
Now, in terms of other options, there are you could say there are agencies
Mhm.
that are community-based
Mhm.
that many times will offer sliding scale services.
Mhm.
They may be receiving, say, United Way funding or have some funding so that they're able to assist
Yeah.
people who are not able to pay a standard fee.
Yeah. And I will say, as a private practitioner myself, and somebody who has a group, I belong to a collective. There's a big group of us across Ontario, and we cover PEI now as well. Well, one of us covers PEI. We receive like no funding, no nothing from the government, grants, nada. And
Mhm,
we offer, almost everyone offers some amount of sliding scale if they can. And
mhm,
we have a free psychotherapy clinic for people locally in our community who meet certain criteria.
yep,
And I think a lot of private practitioners do.
yep,
And so there's often this idea like, oh, therapy is so expensive. And, running a therapy practice is very expensive and becoming a therapist is expensive. So I guess it's all relative. But you can always ask your therapist if they have room for a sliding scale spot, for a lower fee spot, even
mhm,
if it's for a period of time until your insurance benefits kick back in again, to help you out. It's more important to deliver the care,
absolutely.
if it's
Yeah,
within reason, right? If that, so
yeah,
I guess my point is that it's always okay just to have the conversation with your practitioner. Does it,
absolutely.
does it seem like maybe the problem is not that there's not enough therapists in the public system willing to work within that system. And it's more attractive for the therapist to be outside of the public system, I wonder.
I can't speak for all
No.
therapists. I
Yeah, I
think,
don't know.
in terms of public versus private, I think that there can be advantages to both.
Mhm.
I can say I guess you could say there's another bottleneck there in terms of, sometimes in terms of publicly funded.
Yeah.
And then I think this is education to employers as well,
Yeah.
education to government, is
Mhm.
again, you get situations, say within a hospital, where they are hiring particular kinds of practitioners, but not other practitioners. So maybe they're hiring a social worker, but they're not hiring a
Right.
psychotherapist.
Yeah.
And so I think there are instances in which there are practitioners who would be willing to work within the public system,
Yeah.
but they're not being hired,
Mhm.
or because of issues around tax, it becomes too complicated for some of these clinics to work with
Figure
some
that out. Right. It brings up a really important barrier to care in
Mhm,
Ontario and disparity amongst all of those. So if you love your therapist and you're seeing your therapist and you find somebody that's great, and they happen to be a registered psychotherapist and you're seeing
mhm,
their private practice, not only are you paying probably a comparable base rate depending on your area, because it does vary, but you're actually paying extra because you're paying HST on top of that. And
yes,
registered
yes.
psychotherapists are the only healthcare practitioners in this province that have to charge HST.
And that creates a significant barrier, because so even if somebody has a cap of $1,000 through private insurance,
Mhm.
that 13% tax is deducted. So that's fewer sessions that that person has in terms of coverage.
Mhm.
So there's that as a barrier.
Yeah.
Um, if the person's paying out of pocket, yeah, they're paying a surcharge. They're being taxed on what I consider an essential service. I mean,
Yeah.
mental health care is healthcare, and it's an essential service. So a person's being taxed on that. And going back to the previous point, it's sometimes because of that very issue that, and I've seen this happen with job postings where, say, a clinic may be hiring for a practitioner,
Mhm.
but they're not hiring or not listing for RPs, registered
Yeah,
psychotherapists,
because they don't want to
because
deal with them.
they don't want to deal with the
Yeah.
tax.
It's a huge administrative burden. Like it's, for the parties that are interested in supporting small businesses, because most RPs are small businesses in this province,
Yeah.
they have an unfair and inequitable operating cost
Mhm.
and tax burden and accounting fees and all the stuff that comes on top of it that others don't.
Yeah.
And so they're disincentivized.
Yeah, and
You know what I mean?
and it creates again another bottleneck, because you
Yeah.
could say there may be unused capacity there amongst some of the RPs who
Yeah.
could be working within clinics if that barrier were removed.
Yeah, quite possibly. It's a little bit bananas. Okay, so it's election season in Ontario. Yeah.
Yes, it is, as of today, and we have Mental Health Week,
Yeah.
and we have the election.
Mental Awareness Month too. And so, okay, so I will tell you, and I won't ask you to comment specifically on this, but I want your advice as to what to do about it. So, as a therapist who also, I'll say for the people listening, like if it's hard for a therapist to find a therapist, like I can't even imagine what it's like for the average person outside the system to find their therapist, because it is hard. It's hard out there. And so getting to this place where you kind of see all these issues that come up, these barriers, and every week there seems to be a new announcement from all the different political parties about how they're injecting money into this and mental health, and they're funding this community and that community. And then I kind of read through these press releases I try to have like a balanced critical eye, and it really just looks like a lot of administrative programs are being set up, and I never know how much an announcement is actually, it's just an announcement about a transfer that came a year ago anyway, or it's not actually creating more clinicians or more spots to see people and treat people really well right up front. Like you go through this coaching program and do this manual first, and then, you know what I mean? And maybe that works for a lot of people, but when people come knocking at my door, like when the political candidates come knocking,
Yeah.
what should I hold them to task on that is specific enough that they can't bamboozle me with, oh, my party's doing all this? Like, I need like yeah, but so what? Because from what I read in the paper, the wait lists have only gotten longer in the pandemic.
Yes, I mean, yes, exacerbated by the pandemic for
Of
sure.
course.
Yeah, so we had wait lists that were long that are now longer because of the pandemic. And some people having gone through precarious employment situation up and down through the pandemic means there's
Yeah.
less affordability around seeking mental health
Yep.
service. Yeah, so if a candidate comes to my door, I want to talk to them about removing as many barriers to mental health care as possible. And one of those, of course, would be, and I know we're in the middle of a provincial election as of today, and the province can't remove the full tax amount, but if they remove the provincial portion, that I think that also sends a message to the people at the federal level and to other provinces to say, okay, look, remove at least the provincial part of tax to make it more affordable.
The HST is provincial, right? Or is that
Well, we have harmonized sales tax, but there's a provincial part, there's a
so
federal
within
part.
that?
So it's like
Got it.
if the provincial part can be removed, that will go a long way. And then the other aspect of that is, and this may not be as something that gets talked about as much, is right now within the province of Ontario, the College of Psychologists of Ontario, there are PhD registrants and there are MA registrants, and the MA registrants are very well trained. They've had many years of supervision before they practice independently.
MA meaning master's level, just for everyone.
Yeah, so master's level. often referred to as psychological associates,
Right.
and they are performing a really essential function, oftentimes within the school system.
Yeah, no, well, and even in the community, they're providing psychoeducational assessments, ADHD
Uh-huh.
assessments. Like we rely on those services a lot. The school system's so backed up. We don't even, I mean, it's so important.
Yes,
There.
yes, things very backed up within the school system. Again, you can imagine what's happened as a result of the pandemic and issues that kids are going through as a result of not having in-class learning for
Mhm.
on and off 2 years.
Yeah.
So there is a move to close registration
Mhm.
for people with a master's degree.
Does that mean that they will no longer allow them to register with that college?
Yeah. So if somebody is they're not going to be removing people who are currently with the college, but
Mhm.
acknowledging, of course, that we're in an aging population, right?
How does that
And
benefit anybody? What's that all about?
yeah, it does not seem to benefit
Mhm.
anybody.
Mhm.
It could have a devastating impact upon educational assessments, school-based assessments, helping kids.
Yeah.
And yeah,
What what is the implication? So for all the MA level therapists that love doing that work or that are aiming to do that work, maybe
yeah.
they're in school right now. What does that mean for them?
Well, okay, so for somebody who wants to go to, I guess you could say, a master's terminal program for destination registration with the CPO,
Mhm.
it has you could say, a bi-directional impact. So if somebody's within one of those programs,
Yeah.
what does that mean for them?
Yeah.
Like, what
Their
does that mean?
career has suddenly changed, right?
Yes. And then there's the further impact around, well, what happens with those educational institutions?
Mm.
Because if you're an educational institution, I mean, are you going to continue offering that kind of a program
Mm.
if you're saying, okay, where does that student, when they graduate, where do they end up? What's their career path?
Yeah.
So yeah,
Is this like a foregone conclusion that this is happening, or it's just a discussion?
I would say not a foregone conclusion, but it's definitely something that's being
Got momentum.
promoted. Yeah.
Okay.
Yeah.
Yeah. So, and what's the role that the government has in mediating that or stepping in? I mean, so the
Yeah.
colleges are
Yeah.
all administered by the Ministry of Health. Just for everyone
Yes.
listening, there's like 27 health colleges, I think, and the Ministry of Health is the grand poobah above
Hmm.
above all of them. So
Yeah.
whoever the Minister of Health is
Yeah.
would
Yeah.
have a role to play there.
Absolutely. So it's a matter of looking at that and saying, okay, this does not appear to make any logical sense. It harms Ontarians. It harms
Mm,
particularly young Ontarians, and puts them at risk, further wait lists.
yeah.
Um, so don't do it.
Is there some sort
Don't
of
do
like,
it.
is there like a backup plan being proposed for what
I'm
the,
not aware of any backup plan, which is what's further worrying. Yeah.
all right, folks. We've got a couple things for you here that,
So that, and I will say right now, OAMHP, we're coming out with, so for our members, there will be a key points list that we'll be disseminating to members so that
okay.
they can hand that list out when somebody comes knocking at the door, an MPP or a candidate comes knocking at the door, or
Awesome.
that they can email to their candidates.
Okay, I'll make sure that whenever that's available, I link it in the show
Yeah.
notes so people can click on that and kind of read through that stuff. If you've got a fiery little advocate inside of you and these things are important and you want to speak up about it as well, because everybody can be an advocate. I just want to circle back to something that kind of came up earlier that affects everybody, therapists themselves and all Ontarians alike, which is how wait lists and demand grew during the pandemic.
Mm.
And, from my experience, we've never been busier and we've expanded through the pandemic to continuously try and meet the need that we have capacity to meet. And I think, it's interesting. I think there's a lot of people who reached out for therapy for the first time who might never
Yes.
had before, who
Yeah.
were finally like, whoa, like now's the time, which is amazing.
Yeah.
And then there's certain pockets within mental health, like certain conditions that got a lot more visibility because they suddenly expanded, like eating disorders. So
Yeah.
there's been a lot of discussion about how there's been a rise in eating disorders.
Yeah.
And I've seen some interesting conversation about what might be behind that. And I was just curious I'm not an expert. So with your background and the eating disorder work that you do and have been exposed to, can you share with us a little bit about like what's been behind all that?
Hmm. I always say that eating disorders are not about food,
Right.
not about food.
Hmm.
You could say relationship with food. It's a coping tool that somebody may have fallen into.
Hmm.
Um, and it's often about control
Hmm.
and wanting to have a sense of control within a world that can seem somewhat unpredictable. So if you
Hmm.
think about that and think about unpredictability in the context of a pandemic,
Hmm.
everything that people held dear, all of those markers around family celebrations, predictability of going to school, to work, just going out and engaging in normal events, that came to a halt. Job predictability. And so for somebody who may have struggled with an eating disorder and unconsciously using it as a way of having control
Yeah.
of an uncontrollable world
Okay.
context,
More than ever before. Yeah.
more than ever before, this is going to come up. And it's also going to be exacerbated by, unfortunately, heightened isolation.
Hmm.
And I would say not just, but particularly for younger people, um, going into that wormhole of social media
Hmm.
and potentially being very influenced by unhealthy images.
Yeah.
Yeah.
Unhealthy images, unhealthy messaging, unhealthy, like not compatible with having a human functioning body stuff
Right.
that's out
Yeah.
there.
A-
Yeah.
And yeah, and not as many, you could say, checks and balances in place, because with heightened isolation and fewer avenues to connect with actual people,
Yeah.
people may be more influenced by that.
Yeah.
Yeah.
That makes sense to me. I heard someone too, like in high school, suddenly having to stare at yourself on screen all day, not normally a view that young
Yeah.
people have of
Yeah.
themselves, like
Yeah.
literally. And even people at work who suddenly, a lot of people I know now turn their camera off for
Yeah.
video meetings, like they hide their view. So they're not constantly like staring at the increasing wrinkles between their eyebrows and all the things that in the course of a day, it's like you're constantly staring in a mirror, which is not a natural
Not a
thing for us
natural
to be
thing.
doing.
And as I point out to the people I work with, because again, even before the pandemic, people would be influenced by media images, which are very rarely real.
Oh,
And
yeah.
sometimes you see these photos where it will say this photo was not altered or airbrushed, because
Hmm.
that tends to be the exception. And so especially we've got young people, not just young people, trying to compare themselves to something that's not real.
Not real.
And
And not
then
knowing
yes,
that that's what's happening.
like then they're staring at themselves on a screen all day long.
Yeah.
Yeah.
So hard.
Yeah.
So in terms of maybe you're sitting there and you're thinking like, oh geez, maybe that's me and I should talk to somebody about that. There's a point at which with an eating disorder that's active, eating disorders kind of, for therapists can be the most scary sometimes when you recognize that this is something that's going on the one hand. On
Yeah.
the other hand, how often is your therapist in that first intake session asking you questions about how you eat and feed and your beliefs about your relationship with food as an initial screening? And I bet you it doesn't happen a lot. And they'll screen when it comes up. So when it starts to creep up,
Yes.
the therapist will be like, oh, gee, I think we should dig into this.
Mm-hmm.
But it's not necessarily a first pass part of the assessment. Arguably, maybe it should be. But so it can fester for a long time, I guess is what I'm saying.
Oh, it can fester for
Without
long
ever
time.
talking about it. Like we can go to therapy for a long time and this
Yeah.
can actually
Yeah.
not come up. And it's not because you don't have a good therapist, it's because it's sneaky. And we live
Yes.
in a culture that makes it seem normal, all of these things, right?
Right. And it's I mean, we're trained to ask a lot of screening questions, often say in relation to substances,
Yeah.
but not in relation to the, what a person is doing around, say, their eating,
Right.
their exercise.
Yeah.
And
I'll just mark the time. Okay.
me to go back and say that again.
Yeah, sure. Go ahead.
Fax machine. So yeah, we as mental health clinicians, we have as part of our screening process that aspect of, okay, we're assessing for a number of things, substances being one of them,
Mhm.
often not looking at food, relationship with food, and relationship, say, with exercise.
Mhm.
And it can start way before that. So even when that person is seeing their family physician,
Mhm.
is the family physician asking those questions? And there can be a lot of assumptions around what a person looks like.
Mhm.
So what can worsen things is if somebody gets up the courage to talk to their healthcare provider, regardless of the provider,
Mhm.
about a disordered relationship with food and or exercise.
Mhm.
That courage can be slapped down if the response they get is, well, no, you don't look like you have an eating disorder.
Yeah. Oh, we're all drinking a little bit more these days.
Yeah, and yeah, that yeah, exactly.
And
Yeah. Yeah, and so there's that aspect of you, if the person is trying to put themselves forward,
yep. Yeah.
there needs to be
Sometimes
an
healthcare
element.
practitioners are trying to be too reassuring too quickly.
Right. Or have a stereotype of, oh, well, if the person has an eating disorder, they're going to present as extremely thin.
Yep. Yeah.
No, there can be so many issues around eating disorders where the person's not going to present that way, and they may
Yep.
be struggling significantly
Yeah. Yeah.
and may have been for years. Yeah.
Thank you for outlining that because I think it is something sometimes people have like a sneaking suspicion about and they're never really sure whether
Mm,
it's worth bringing up, whether they should mention it. Like it's kind of you drop a hint here or there and see if the care partner, your healthcare partner picks up on it and runs with that ball.
mm,
So, yeah, that's a thing for
yeah.
sure. It just so one more, from accessing treatment point of view. So, maybe you're not at the place where you need to be hospitalized. It's for a medical doctor to determine whether that's the place
Right.
or not. But if you're not at that place, finding care in the community. So there's hospital programs, outpatient programs for families, because correct me if I'm wrong, is family-based therapy, that's first line, right?
Family-based
For a young
therapy
person.
for a young person can be extremely helpful.
Yeah.
I think it's finding that best fit, what
Okay.
works for that person,
Okay.
but oftentimes involving the family, and supporting the family is also a
Yeah.
key
Like
component.
everybody needs some support around it.
Yeah,
Yeah.
yeah, yeah.
It's never just like one person in a family unit that's got like a problem and needs to be fixed. I think I want to dispel that myth.
Exactly. And it's sometimes something where you could say parents, siblings, they're truly puzzled around, well, what should I or shouldn't I say? How can I help or
Mhm.
support this person?
Yeah. Yeah. So having like someone with a lot of experience, such as yourself, guide you is a wonderful opportunity to be able to have.
Yeah.
Yeah.
Yeah. To have
Yeah.
that safe space. Yeah.
The, the other thing that, I mean, it makes me, I said that line in there about drinking more, like there's also been those headlines that substance use has gone way up.
Yeah.
And, being trapped at home with your family,
Mhm.
maybe people can understand that, or the monotony of everyday life. And,
Yes.
whether you've really struggled in the past or it's something new. There's certain rules in all of our different cultures, subcultures, communities about what appropriate substance use is. And I
Yeah.
find as a therapist, I ask much more specific questions now. Like my initial question is like, do you have more than 3 drinks in a night, more than 3 times in the past month?
Hmm.
So I start to get really specific about
Yes.
what are we talking about here? What's recreational? What's social? And I base that on the Canada guidelines, the Canadian
Yeah.
for substance use, recreational drugs, or alcohol. And then it's different for every person and every family. So have you found that as well? Is that something else that's topical, either with the association or even just in your own practice?
I do, yeah, I do find that people have also turned to, and it's a slippery slope. It may have started as a way of, again, coping tool to
Mhm.
numb out, to chill out in relation to strains, stressors around the pandemic. But
Mhm.
then it starts to build momentum. But I agree with you, Christina, asking those very specific questions, because say if you say, well, recreational use, how does each person define that?
Mhm. What does it
um
mean to you? Yep.
yeah, what does it mean to that person? And so sometimes it can be quite surprising to me what somebody may define as recreational use in terms of healthy guidelines, and say, oh, this is actually concerning for their health. Yeah.
Yeah, well, I mean, the fascinating thing is like when you look at like I think the federal government did surveys of like what for say cannabis, for example,
Yeah.
what are people actually using it for? And they had this force rank list of the top 10 reasons. And the top 6 reasons are all connected to mental health.
Hmm.
So people
Yeah.
are
Yeah.
partaking, but they're treating mental health conditions. So when you know why, like not, it's important not to make assumptions about why people use and find out the
No.
function of
Yeah.
what they're getting out of it, because it's all relevant. It's all fodder for what we're talking about, in
Yeah.
therapy. It's important stuff to address, right?
Absolutely. And I work a lot with people who have chronic pain, and
Yeah.
sometimes people are using, you could say, marijuana or alcohol to help with the chronic pain.
Yeah.
Yeah.
Yeah. Yeah. It would be nice if all the barriers that we face as Ontarians to find the right practitioner for ourselves and then just be able to just get the help we need could be removed. And so I guess maybe that would be one of the questions I will ask my candidates, which is I try to find exactly how much they know about how kind of
Mhm.
patchwork the system is in a lot of ways and what their own experience in the system is if they accessed care for themselves or for
Yep.
their family. And how did they find that? Right.
Yeah,
That's
that's an
probably
excellent
great
question.
benefits, right?
Yeah, in terms of you, because there's that aspect of, if somebody's walked through those shoes, either themselves or a family member, were they struggling to get care? Were they on a wait list? Was there disjointedness around the care that they were seeking, and being able to access it? Yeah.
Yeah,
Yeah.
100%. Is there anything else around barriers to care you think is important to highlight, either for therapists themselves, whether they're members of the OAMHP or not? Because there's other associations people can be members of. They might be members of both.
Yeah.
They might be members of a national one. I'm not too sure. Are there any like messages for them in particular that you'd like to share?
A message for everybody, and I think this is changing, but it's not changing quickly enough, is to say mental health is health. And a barrier to accessing care, and a barrier to talking about the barriers, is any stigma around mental health care and seeking mental health services.
Yeah.
So the more openness about that,
Mhm.
that's going to reduce a barrier right there. If, for example, we don't hide dentistry.
Yeah.
Yeah, but to talk about it openly
Yeah,
and
I think it's
talk
Howie
about the
Mandel
challenges.
said it once, that if you can leave work and be like, I gotta leave at 3 today, I got a dentist appointment.
Yeah,
Could you also say, I gotta leave at 3, I gotta go see my therapist? And
yeah,
if you're like, whoa, I wouldn't see that, I wouldn't say, that's your own self-stigma. Like, that is how stigma against ourselves
yeah,
shows up.
yeah,
Right?
and
Maybe some
yeah,
people wouldn't tell the world, they were to tell their floor they're going to the dentist anyway, right? Or just tell your boss, but it's an easy comparable there.
yeah, and it's that aspect of if there feels that safety, that openness, even around in the workplace, saying, okay, people need mental health support in the same way as they need that physical health support.
Yeah.
If somebody's broken their arm and they need accommodations at work, having that that same conversation around mental health.
Mhm.
But yeah, if somebody is able to say, yes, I'm going to see my therapist after work, does that create additional safety for people around
Yeah.
that person? And
Especially
that,
if it's a leader or a people manager or a
yeah,
person in a position of power,
yeah,
right? It makes them seem human.
yeah, yeah.
Yeah. That's awesome. Anything exciting coming up aside from this advocacy around the election for OAMHP, stuff happening in the future? I don't know if you're privy to share, if you're allowed to.
Okay,
Yeah.
so we don't have a final program yet, but we're excited to be having. Okay, so we have existed for over 40 years,
Oh,
and it was traditional for us to have an annual conference, and the annual conference was a chance for practitioners to network, to meet, to attend workshops, to gain new knowledge, and continuing education credits. And then when the pandemic hit, and thanks to all of the staff and the board and committee members for pivoting things around and offering a virtual conference. And we've
mhm.
done a virtual conference successfully for the last 2 years.
Okay.
But this year, we're going to be returning to some face-to-face. We're going to be offering a hybrid conference,
Oh, amazing.
September. Yeah, and the reason for hybrid is, while I don't like to talk about blessings of the pandemic, what we learned through the virtual realm is that we attracted people to the conference who previously may not have attended an OAMHP
Yeah,
conference.
not everyone can travel. Yeah.
Yeah, not everybody can travel, and so this allowed people to connect. So coming up, we're going to do, fingers crossed, a hybrid conference,
Nice.
September 29th to October 1st.
Okay.
And it will, if you're in person, it's in Toronto.
Yeah.
And otherwise you can connect. We'll have exhibitors. We will have professionals delivering workshops, chances to network.
Nice.
I miss, and it would be nice to be able to see people face to face or virtually, whatever works for that
Yeah,
individual.
no kidding. Is registration open yet for that or not yet?
So registration is not quite open for the
Okay.
conference yet, but there's information. Look at the website for
Okay.
Links to the conference, because
I'll
there's
link that one as well. Yeah.
and it's all at oamhp.ca.
Mhm.
Yeah, yeah.
We'll include a link to that in the show notes for people that are interested in seeing what that opportunity is, for sure. So I'm conscious of time. Thank you so much for being here. I just want to summarize, you know, for all of us in this province, I think everyone, even if you're not working in mental health or, have had experience with a therapist, kind of has gotten the message. The awareness part, I hope, is over. Like,
Mhm.
oh, let's talk. We've got to be aware of it. It's like, okay, now what are we going to do about it? Right.
Right.
everyone, if you're a human being with, skin and eyeballs and a brain and a nervous system, you got mental health, right? It's just part of the healthcare of being a human. So in demanding that we get treatment for the neck up as well as the neck down, it's okay to ask our politicians about this, because at the end of the day, they're the ones that administer this process, right? And that's what we pay them to do. And that's what they're responsible to us for as taxpayers. So don't be shy to ask those questions. There's wonderful resources out there about the types of questions you can ask and those conversations that you can have. And it doesn't hurt to ask questions, right?
Yes.
The thing about the HST piece, if you're seeing an RP, a registered psychotherapist, and paying HST, and you don't want to have to pay HST, it's not fair, right?
No.
So ask your candidate about that. Why? Because the thing about HST is that RPs shouldn't have to be paying HST, because the rules about who pays HST and who doesn't and when you can apply to have that removed passed like 2 years ago. Like, just a quick backgrounder. In Canada, like 5 out of 10 provinces have to be regulated, meaning the government's getting all in there and making sure everyone's doing the right thing. And then that happened a while back. Like, I think we're at 6 now, right? Provinces.
Well, okay. So if I have a moment, I can talk to the glitch there.
Yeah, please do.
So the glitch there,
but I think it's important for people to know the background.
So we you could say that there is regulation within the 5+ provinces. The barrier that is now occurring is that in some provinces, the practice or the professional title is psychotherapist, psychotherapist, whereas in others it's a counseling therapist.
Oh my God.
And so it becomes a matter of saying, then it's like, well, it's not the same profession. Now, having said that, I think it's very important to look at the scope of practice. So for example, if somebody applies to, say, the College of Registered Psychotherapists of Ontario from another province, say they're registered in Prince Edward Island with the College of Counselling Therapy, and they apply to Ontario, then they are going to get in via the Canadian
laws.
Trade agreement. So that person is going to be provided with a license to practice within the province because of the Labor Mobility Act. Because the scope of practice is the same. So
it's whether you call yourself a mental health therapist, a psychotherapist, we're all pretty much providing the same thing.
If it's a regulated title, a regulated practice providing psychotherapy, counseling therapy.
Okay. So there's administrative and technical paperwork glitches, guys, that are making you pay HST when I think you shouldn't have to. I think a lot of people think you shouldn't have to. So it's a wonderful thing to bring forward and have a conversation about when you're voting and with your candidates.
And asking the candidate, are you aware that there is a professional group, a regulated professional group providing an essential service, having to charge HST to deliver mental health services? Some candidates be aware.
I'm so grateful as a working therapist in this province that there is an association as strong as the OAMHP. I will say, like, it was really nice for me. I was on the board for, I think, 2 years to just, these are volunteer positions, right? Just to witness the amount of work that people are spending, clearly just from a place of passion and caring about the profession and how we do these jobs, on top of their regular workday, is really phenomenal. And I feel really privileged and grateful that I had that opportunity and that I still connected to you and you're willing to come on my little podcast here to talk to people and share your knowledge and expertise, because I think people really love hearing these kinds of, it's almost like an insider conversation, right? Because nobody else has access to this information. Even as a therapist, I feel like if I didn't volunteer to do the things that I did, I wouldn't know the things that I know now. So it's been so helpful, even to me, just as a practitioner, right? To have connections, the networking, to know the inner workings of the system, because I use all that information on behalf of all my clients.
Yeah, and for you, I mean, your time on the board, and yes, the passion of the board, the staff at OAMHP, but for you to have this podcast to get that word out there, and you clearly have a passion for this, and thanking you for this opportunity to speak about these really important topics, especially in the context of a burgeoning election.
Yes,
Yeah.
yes. So with that, I will say thank you. I will let you get on with your day. I really appreciate your time here. And hopefully this spurs some great dinner table conversation and conversation with candidates on people's doorsteps.
Absolutely. Yes. Thank you. Thank you so much for having me here.